Hello guys, and welcome back to the channel. We are continuing with our CBT practice questions, a comprehensive guide to your test of competence part 1, and we are doing questions 61 to 70. So without further delay, let's begin with our questions. Question 61 asks, the nurse is caring for a diabetic patient and when making rounds notices that the patient is trembling and stating they are dizzy. The next action by the nurse would be A. Administer patient's scheduled metformin. B. Give the patient a glass of orange juice. C. Check the patient's blood glucose. Or D. Call the doctor. I'll give you a few seconds to think of your answer. And the answer is C. Check the patient's blood glucose. The signs and symptoms appear to be that of hypoglycemia, but they could also represent other conditions. The first step in the nursing process is to assess and gather all the required information. Obtaining the blood glucose reading would be beneficial before giving the diabetic patient orange juice or metformin. So your answer is C. Check the patient's blood glucose. Question 62. Which of the following is not a part of the 6 rights of medication administration? Is it A. Right time, B. Right route, C. Right medication, D. Right reason? And your answer is right reason. Many organizations adopt the 5 rights approach to medication administration, and the 5 rights are right patient, right drug, right dose, right route, right time. So your answer is D. Right reason. Question 63. The nurses on the day shift report that the control drug count is incorrect. What is the most appropriate nursing action? Is it A. Report the discrepancy to the nurse manager and pharmacy immediately? B. Report the incident to the local board of nursing. C. Inform a doctor. Or D. Report the incident to the NMC. And your answer is A. Report the discrepancy to the nurse manager and pharmacy immediately. The nurse manager and the pharmacy must be alerted immediately of any discrepancy in the controlled drug count. These substances are regulated and an incident report must be completed. So immediately report the discrepancy to the nurse manager and pharmacy immediately. So your answer is A. Question 24. The nurse has made an error in documenting client care. Which appropriate action should the nurse take? Is it A. Draw a line through error, initial, date, and document correct information? B. Document a late addendum to the nursing note in the client's chart. C. Tear the documenting note out of the chart. Or D. Delete the error by using whiteout. And your answer is A. Draw a line through error, initial, date, and document correct information. An error in documentation requires that the nurse draw a single line through the error, initial, and date the line, then document the factual and correct documentation in the medical record. So your answer is A. Question 65 asks, the UK regulator for nursing and midwifery professions within the UK with a stated aim to protect the health and well-being of the public is A. Is it GMC? B. Is it NMC? C. Is it BMC? D. Is it WHC? And your answer is B, NMC. The NMC, which means Nursing and Midwifery Council, maintains a register of all nurses, midwives, and specialist community public health nurses eligible to practice within the UK. So B is your answer. Question 66. In what order should the 4 phases of wound healing be? Is it A, inflammation, proliferation, hemostasis, maturation? B, hemostasis, inflammation, proliferation, maturation? C, proliferation, hemostasis, maturation, inflammation? Or D, maturation, inflammation, proliferation, hemostasis? In what order should the 4 phases of wound healing be? And your answer is B, hemostasis, inflammation, proliferation, maturation. Hemostasis occurs within minutes, inflammation 1 to 5 days, proliferation within 3 to 24 days, and maturation within 21 days onwards. So your answer is B. Question 67. After a lumbar puncture, your patient becomes unconscious. What will be the reason? Is it A, increased intracranial pressure, B, headache, C, side effects of medication, D, cerebrospinal fluid leakage? Your answer is D, CSF or cerebrospinal fluid leakage. The presence of clear fluid should be reported to a doctor immediately, especially if accompanied by symptoms such as loss of consciousness, motor changes, problems voiding. Your answer is D, CSF leakage. Question 68. A patient is prescribed metformin 1000 milligrams twice a day for his diabetes. While talking with the patient, he states, I never eat breakfast, so I take a half tablet at lunch and a whole tablet at supper because I don't want my blood sugar to drop. As his primary care nurse, you A. Tell him he has made a good decision and to continue. B. Tell him to take a whole tablet with lunch and with supper. C. Tell him to skip the morning dose and just take the dose at supper. Or D. Tell him to take 1 tablet in the morning and 1 tablet in the evening as ordered. And your answer is D. Tell him to take 1 tablet in the morning and 1 tablet in the evening as ordered. The patient should take the metformin as ordered. Metformin should not cause low blood sugars due to the way it is used in the body. So your answer is D. Question 69. What is meant by Gillick competent? A. Children under the age of 12 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. B. Children under the age of 16 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. C. Children under the age of 18 who are believed not to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Or D. Children under the lawful age of consent who are believed not to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. So the question asks, what is meant by Gillick competent? And your answer is B. Gillick competent means children under the age of 16 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Children under the age of 16 can consent to their own treatment if they are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. So the answer is B. Question 70. How many phases of Korotkov songs are there? How many phases of Korotkov songs are there? Is it A, 3, B, 4, C, 5, D, 6? And your answer is? And your answer is C, 5. There are 5 phases of Korotkov songs. And for those of you who might be wondering what Korotkov songs are, they are songs heard when a blood pressure cuff is deflated around the upper arm and a stethoscope is placed over the brachial artery. So these songs are used to determine blood pressure. So the 5 phases: clear tapping, repetitive songs which increase in intensity and indicate the systolic pressure, murmuring and swishing songs heard between the systolic and diastolic pressures, sharper and crisper sounds, distinct muffling which may sound soft and blowing, silence as the cuff pressure drops below the diastolic pressure. So your answer is C, 5 phases of Korotkov songs. Alright guys, so we have come to the end of another session. Do come back for more CBT questions. Don't forget to like, comment, share, subscribe. Tell a friend to tell a friend about these questions, which is gonna help with the preparation for NMC and your transition to the UK. Alright, bye.